From the original discovery back in the 80s of PI3K, there have been several important steps. For instance, the discovery that PI3K is able to phosphorate a lipid, that this lipid is called phosphatidylinositol triphosphate, is able to activate, to recruit important components of the PI3K pathway, such as, for instance, AKT, to the first generation of the mouse model that have validated the role of this important pathway in cancer. In this respect, I was very lucky to be part of a lab that has worked on PTEN, that is one of the major negative regulator of the PI3K pathway. So PTEN was discovered in 1995, and PTEN was discovered because it was frequently associated to tumors like breast cancer, glioblastoma, and prostate cancer. And the frequency of loss of this gene or mutation of this gene were really very, very high. Ramon Parsons, back in the 90s, cloned the gene. Immediately after, in 1999, there were the first knockout of PTEN from different labs that demonstrate the relevance of activation of the PI3K pathway. Why this is important compared to the discovery of PI3K is because the PI3K mouse model didn't have or didn't show a profound effect on tumor regenesis, as on the contrary observed by the PTEN mouse model. So I would say that one essential discovery in the pathway has been really the generation of mouse model of PTEN that has allowed us to study the role of this pathway in different type of tissue. Another seminal discovery that came later on is the fact that this pathway can be targeted for cancer therapy. So when I start my postdoctoral fellow, I joined the lab of Paolo Pandolfi, and I was one of the only oncologists that was joined a lab. And what we were studying in that moment is how we could use novel inhibitors of this pathway, such as, for instance, TOR inhibitor or PI3K inhibitors. And this type of research was quite fast, because in few years, I mean, we have amazing results in mouse models that were the basis for the clinician to start the clinical trial. What is interesting to say is that we were perhaps between the first to study this inhibitor in the context of genetically engineered mouse models, which differ by other mouse model for the fact that they have an intact immune system, and that this allowed us really to study in a more complex organism the role of this inhibitor. I personally study one inhibitor, which is an mTOR inhibitor, and this allowed me to also to discover that this inhibitor was only partially function in the context of PTEN tumors. I think that was later on validated also by clinical trials, and that combining these inhibitors with additional inhibitors that I have identified as effective in PTEN was resulting in an improvement of the treatment. What I'm actually doing now in our laboratory is try to identify novel, important small molecule inhibitors or compounds we can be active in the context of PTEN tumor. So starting from my experience with my postdoctoral research fellowship, I continue on this line using transgenic mouse model to validate to test relevant compounds that are inhibitors of the PI3K pathway in general, with the aim to identify the best compounds, the best combination of compounds. It's something that I have started to do, for instance, already in the laboratory of Paolo Pandolfi, but that I'm continuing to do now. So we focus selectively on compounds that enhance senescence in cancer and did not drive apoptosis in tumors. What we believe is that compounds that enhance senescence will drive a irreversible growth arrest, not only in cells that are actively proliferating, such as cancer cell, but also in quiescent cancer initiated cells that are known as stem cell. While it's very well known that chemotherapy cannot affect stem cell, but only hyperproliferating cell, we think that prosenescent therapy will let the cell age, arrest irreversibly, therefore the tumor will not be able to propagate. This is the reason why we are extremely fascinated by this novel aspect of research. We have recently identified some compounds which are extremely effective in driving senescence in PTEN tumor that we will try to move in the clinic in the next years.